Hello there, and welcome to the third part of our lecture, which is named the measurements. And the measurement is very important to understand one of the main characteristics of science, and that to measure the quantities of the interest. Okay, and the quantity start from measuring using the hand span, or let's say the base or the foot span, or the arm span as well. Then we will start with the using X-ray and the volume measurement, temperature, pulses, weight, blood measurement or blood pressure. All of them is kind of the measurement, and then we will understand how these they are working to do so. Start from the we have two types of the measurement. We have quantitative measurements, okay, which is mean quantitative. That's mean we are talking about numbers. So a thermometer, for example, measuring the temperature gives you numbers. For example, if I am saying thermometer and your temperature is 37, um, 37 Celsius. That means we are talking about, let's say, numbers. If we are talking about weighting machine, which is measuring weight, and your weight is 80 kilogram, that means you are talking about numbers. If you are talking about the galvanometer, and we said your blood pressure is 180 over 80 millimeter mercury, that means you are talking about uh, numbers. If you are talking about the syringes and you see your, like they take blood from you or 2 cc, okay, that's mean we are talking about the numbers. So all of these things, that's mean the output will be numbers we name as a quantitative measurement. So quantitative measurement is just like I will write here the type of measurement that makes the output as numbers. Okay, like for example, a thermometer, weighting machine, and so on. While the qualitative measurement is just like a give information about the qualitative, which is a qualitative. When we say quality, we are talking about when you say quality, and you know when you talk about equality, that means we are talking about images. Okay, talking about images, which is for example X-ray, CT or CT scan. Let's say X-ray image, CT scan, ultrasound, MRI, and etc. So and these things, all of them, it just taking time for the qualitative measurement. So if I want to define the qualitative measurement, I will say it is the type of the measurement that that give the output as images rather than numbers. Okay, which is both of them, they are important to get the information from the body. In terms of the measurements, we have some many measurements that we have, but in terms of the measurement, we have divided them between the measurement involving the body and time. Okay, so they are doing with the time. For example, measuring of repetitive process, one of the type of the measurement in term of the in term of time. When you are hearing there's time with the measurement, that's mean you are talking about time measurements and time. That's mean you have two type measurement of repetitive process and then measurement of non-repetitive process. Measurement of repetitive process, such as pulses. For example, your pulse is 100 or 70 pulse or 70 pulses per minute. Okay, so that's mean you are repeating number of pulses to be 70 per minute to get the measurement. And this one, that means you are repeating the process, or maybe not repetitive process, non-repetitive process. For example, the kidney is removing the foreign substance for just like from the blood once per week. So that means it will be just one measurement to understand the, or one process to understand the measurement. So no need to have that one. And the repetitive process usually can be do using, let's say we can use it, sorry, per second, per minute, per hour, and so forth. For example, the pulse rate is about 70%, while 70% per minute. So I'm repeating the pulse 70 times per minute. Our breathing rate is 15 pulses per minute. Okay, this is the type of the measurement that we have. So what the doctor will be do when we have just like when he start to make the, or to check or decide if the patient are ill or not. He will do medical history first. Okay, so he will ask you about what do you have, what the things that's happening in the history, and then he will do some physical examination. For example, check the pulse rate, maybe the breathing rate, maybe one of the physical examination is just like here, your heart beat. Okay, so all of them is just like a types of the measurement that we have it in the previous slide. So he will do this one, and then he will just like start with the doing some let's say a result of the physical measurement, which is the quantitative measurement. Then he will decide two things. He will decide if the decision is correct or not, if it's right decision or wrong decision. And you obvious, if you have right decision is right, so you have this disease and he recognize it well. However, just like the things will be more interested if you know that the doctor make the wrong decision, and that's fine, that's totally fine. The doctors like depend on the measurement can do just like a wrong decision. And the wrong decision is just like we have a false positive and you have false negative, these two types of the wrong decision that we have. And the division of the false positive is that when the patient is diagnosed to have a disease, but he or she does not have it. Okay, so for example, we have a patient and this patient said, the doctor said this patient have a disease, but actually he don't have it. And the false negative is the vice versa. When the patient is diagnosed to be free of the particle disease, when he or she does have it. So that's mean the doctor said you don't have this disease and actually you have it. Okay. And in some situations, a diagnosis error can have a great impact on the patient's life. And this is the example that we have. A young woman have a rheumatic heart condition and spending time to incomplete bed rest. So just he's spending all the time in the bed before it was discovered that was a false negative diagnosis. So before we finishing it, he discovered to be a false negative or false positive. What mean by false positive? That means the doctor said you have a disease, but you don't have it. So the doctor first, you have this disease first, he diagnosed her. You have rheumatic heart condition, but actually she don't have it. Okay, and then this disease, it should be the person should be at rest, spending times on the bed. Why? Because it will be cannot be the heart is not working well, so you don't need to have pushing more work on it. Okay, and this one doctor make a false positive one. Another case we have a cancer cells or cancer, okay? Always early stages of cancer, it's easy to make a false negative. What that mean? That means the doctor said you don't have cancer and actually you have it because in the early stage you cannot diagnose it, okay? And because of the tumor is small. Okay, since the probability of care depending on the early detection of the cancer, a false negative diagnosis is greatly reduce the patient chance of survival. This is in the past. Now they have the BET scan. The BET scan can be used in terms of the let's say to detect the cancer in the early stage. So the cancer, one of the type of the disease, can be diagnosed as a false negative and the false positive. So you have two examples, example of the cancer and example of the rheumatic heart condition is considered as a false positive, but it was just like he said, you have the disease, but actually you don't have it. How can we avoid these things? How can we avoid the error, false positive and false negative? By research, of course, making more research, you will have developed new techniques to get the result correctly and precisely. And then you have a new clinical test and better instrumentation. For example, now they are using BET scan, better instrumentation to get the diagnosis of the cancer cell in the early detection. Okay, how can we reduce the error in the our uncertainty error? The error is not accurate by using taking care on in the measurement, repeating measurements. So this is why we are doing it in the lab. We are repeating the measurement to reduce the error using reliable instruments. Okay, instrument that can do the things correctly or correctly, and then calibrating the instrument, like make the instrument using the good environment to make the results clear. The last thing on this section is just the accuracy and the precision, which is, as I said, you should be accurate and precise to get the measurement. And the definition of the accuracy is how close a measurement value to the actual value. Okay, so if you have, for example, any value, how close a measured value to the actual value. For example, if I say the gravitational force G equal 9.81 meter over second square, okay? And this one is a true value. All right? Then if I am taking the measurement experimentally and find G in total equal 9.9 meter per second meter over second square. That means you have you are accurate in terms of getting the result. The result now is accurate. Okay. In terms of that means your value that you have it in the lab is near to the value that you have it in the theory. Okay, and that one, that's mean you are, I will write here, you are accurate. Okay, and this is the accuracy. However, what is the precision? Is how close the measured values, now values, not value, measured values are clear to each other. Okay, so let me do it again. How close the measure values now, not value. So many like more than one value to each other. For example, return back to the let's say the gravitational force. You are doing the experiment, and the first trial of measuring the experiment, you find G is equal 9.88. Of course, meter per second square. And then you are doing again the measurement and find it 9.86 meter per second square. And then you are doing it again and find it is 9.55 or 9 of 75 meter per second square. That's mean you are precise in terms of the measurement. Your measurement, they are close to each other. Okay. However, if you have, for example, one measurement is 9.9 meter over second square, the second one is equal 11 meter per second square, the third one will be 12.5 meter per second square. That's mean the numbers between them, they are far away. That's mean you are not precise. So when the measured value are close to each other, like the example here, they are close to each other. That's mean you are talking about just like you are precise. If they are far away from each other, that's mean you are not precise. Okay, and the things is clear when we see this example here. So the person here, this spot, the small spot is the experiment to check if you are precise or not. And this is the point here in the middle. That's mean you are precise or not. So if you are seeing here the measurement, they are close to each other, and in the middle of this spot, that's mean you are accurate and precise. However, see the second case, they are close to each other, but they are far away from the actual value. Okay, that's mean you are not accurate, you are precise. You are accurate and not precise when they are close to the main value, but they are far away from each other. Not accurate, not precise, you will find like they are far away from each other and they are far away from the main value. So the difference between the accuracy and the precision reflect how a close measurement is to an actual value, but they are not the same. Accuracy reflect how close a measurement to the known or accepted value, as we said for the gravitational force. For example, the accepted value is 9.91 meter per second square, and your measurement, you have it, the experimental value for the gravitational force, you get it 9.9, for example, so you are accurate. While the precision reflects how reproducible measurements are, even they are far away from the expected value. So for example, you are doing the same experiment and you are measuring not one time the measuring of the gravitational force. You are doing 2 or 3 or 4 times. They are far away from the actual value, for example, but they are close to each other. That means you are talking about you are precise, okay, but not accurate. Okay, measurements that are both precise and accurate are repeatable and very close to the actual value, like this one. Repeatable, so they are close to each other and they are close to the true value, which is, we suppose this spot here is the true value. And this is the end of part 3. Thank you very much.